Today, this is Professor Will, CBMD PhD. Today's Thursday, August 22nd, 2019. It is 22:46 and 46 seconds Eastern Standard Time. What's 25 good reasons why psychiatry must be abolished? 1. Because psychiatrists frequently cause harm, permanent disabilities, death of the body, mind, and spirit. 2. Because psychiatrists frequently violate the Hippocratic Oath, which orders all physicians do no harm. 3. Because psychiatrists patronize and disempower people, especially their patients. 4. Because psychiatry is not a medical science. 5. Because psychiatry is a quackery, pseudoscience, which lacks independent diagnostic tests, testable hypothesis, and cures for schizophrenia and all other types of alleged mental illness or mental disorder. Number 6. Because psychiatrists cannot accurately and reliably predict dangerousness, violence, or any other type of human behavior, yet make such claims as expert witness, or the media promote the dangerous mental patient myth stereotype. Number 7. Because psychiatrists have caused a worldwide epidemic of brain damage by promoting prescribing brain-disabling treatments such as neuroleptics, antidepressants, electroconvulsive brainwashing, electroshock, and psychosurgery or lobotomy. Number 8. Because psychiatrists manufacture hundreds of mental disorders classified in this Bible called Diagnostic and Statistical Manual of Mental Disorders. The modern witch hunting manuals such as Mental Disorders and Symptoms are in fact negative class and culturally biased moral judgment for dissonant ways of coping with personal problems and alternative ways of perceiving, interpreting, or being in the world. Number 9. Because psychiatrists blinded by their medical model, bias, fraudulently pathologize, and label people's serious life or existential crisis as symptoms of mental illness or mental disorder such as schizophrenia or bipolar, affective disorder, and personality disorder. Number 10. Because psychiatrists compound this fraud by falsely claiming, without scientific proof, that these mental disorders are caused by a biochemical imbalance in the brain, genetic factors, or genetic predispositions, despite the fact that there are no genetic factors in mental illness. Number 11. Because psychiatrists frequently misinform their patients, families, and the public by claiming that brain-disabling procedures such as neurotoxins, e.g., antipsychotic medication and antidepressants, electroconvulsive brainwashing, electroconvulsive therapy, ECT, psychosurgery, lobotomy, and other brain behavior modification mind control procedures are safe, effective, and life-saving. The exact opposite, tragically true. 12. Because psychiatrists routinely deceive or lie to patients, prisoners, their families, and the public. Number 13. Because psychiatrists routinely willfully violate the medical ethical principle of informed consent by misinforming or not informing their patients about the numerous toxic, disabling, and frequently permanent effects of the neuroleptics such as memory loss, tardive dyskinesia, tardive psychosis, Parkinsonism, dementia, all signs of brain damage and death. Number 14. Because psychiatrists routinely threaten, intimidate, or coerce many patients, particularly women, children, and the elderly, and prisoners, into consenting to health-threatening brain damage treatments such as the antidepressants, neuroleptics, electroconvulsive brainwashing, and high-risk experiments. Number 15. Psychiatrists frequently fail to fully inform psychiatric inmates and prisoners about existing safe, humane, non-medical alternatives in the community such as survival-controlled crisis centers, drop-ins, self-help or advocacy groups, diet, massage, holistic medicine, affordable supportive housing, and jobs. Number 16. Because psychiatrists are sexist and frequently stereotyping women in crisis, hysterical or over-emotional, blaming women whenever they voice real complaints and assertively express their feelings and emotions, prescribing massive doses of tranquilizers and antidepressants to disproportionately large numbers of women, and sexually assaulting women in their offices and institutions. Number 17. Because psychiatrists, particularly white male psychiatrists, are homophobic, the American Psychiatric Association, APA, once labeled homosexuality as a mental illness or a mental disorder, and have used forced electroshock on lesbians trying to coerce them onto adopting a heterosexual lifestyle. Number 18. Because psychiatrists are ageist in prescribing tranquilizer, antidepressants, medications, and electroconvulsive brainwashing for disproportionately large numbers of elderly people, a form of elder abuse. Number 19. Because psychiatrists are racist and disproportionately incarcerating and drugging people of African descent, Aboriginal people, other people of color, and labeling them psychotic or schizophrenic. Number 20. Because psychiatrists routinely violate people's civil rights, human rights, and constitutional rights such as imprisoning innocent people without court trial or public hearing. involuntary commitment, and subjecting them to cruel and unusual punishments or torture such as forced drugging. Number 21. Because psychiatrists masterminded the mass murder of hundreds of thousands of vulnerable people, including disabled children, the elderly, and psychiatric patients during the Holocaust in Nazi Germany, and selected hundreds of thousands of concentration camp prisoners for death, T4, euthanasia program, historical facts still missing in psychiatric textbooks and histories. Number 22. Because psychiatrists have willingly participated and administered mind control experiments in the United States and Canada since the early 1950s. Its chief target have been poor patients, women, dissidents, and prisoners. Number 23. Because psychiatry, particularly institutional biological psychiatry, is based on 3 F's: fear, fraud, and force. Number 24. Because psychiatry is a form of social control or punishment, not treatment. Number 25. Because psychiatry, particularly institutional biological psychiatry, is fascist, a direct threat to democracy, human rights, and life. Good day, this is Professor Will, CBMD, PhD. It is now Friday, August 23rd, 2019. Hope you enjoyed listening. Have an excellent day.